Welcome. My name is Peter Strong, and I'm a mindfulness therapist based in Boulder, Colorado, and I offer online mindfulness therapy via Skype for the treatment of anxiety and depression, for OCD, for addictions, and also for PTSD, which is something I'm particularly interested in. So people ask me all the time, does online therapy work? Is online therapy an effective way of getting professional help to manage anxiety or depression? And my answer is that yes, online therapy is very effective. Online therapy does work. But you have to look at a couple of factors. The first is that online therapy works best if it also includes some form of video interface like Skype. Being able to see each other is very important for effective communication and therefore effective psychotherapy. You have to be able to see each other as well as speak to each other in real time. So if you can use Skype to talk to your therapist, then that therapy is going to be practically just as effective as meeting in person with the therapist. Some forms of psychotherapy that may be focused around developing a very close relationship, or perhaps some form of hands-on intervention like body-centered therapies, may not be effective when delivered online. But for most of the forms of talking therapy, certainly therapy via Skype is just as effective as meeting in person. You have to also remember that you can't get prescription medications through online therapy sessions, but that's fine. From my point of view, I don't advocate medications for the treatment of anxiety or depression because they don't really address the underlying cause of your emotional suffering. So in the online therapy sessions that I offer, we look very closely at the underlying psychological process that is causing your anxiety or depression. We look at the process that has become habitual, that's become stuck, and that continues to generate your emotional suffering. Mindfulness therapy is extremely effective for doing this because it's essentially a way of learning how to investigate your own mind, how to investigate your thoughts and emotions without becoming lost in them. So the first stage in mindfulness therapy is this of learning how to overcome the habit of reactive identification. This is the common process where we become lost in our thoughts, where we become overwhelmed by our emotional reactions, and we basically lose perspective and lose the element of choice in how the emotional reactivity affects us. So being able to overcome reactive identification is a very important stage in any kind of psychotherapy, and it is the central focus of mindfulness therapy. I will teach you how to overcome reactive identification so that you can effectively be conscious of your emotions or thoughts or memories or trauma in the case of PTSD without becoming identified. So you can sit as the observer and look at your own emotions and thoughts. When you can do this, when you can develop this level of conscious observation, then you can begin to exercise choice and begin to help change those patterns of emotional reactivity. So anxiety and depression and addiction and OCD and also traumatic emotional reactivity are, at the end of the day, psychological habits. And these habits can be changed by bringing consciousness to bear on them. So if you'd like to learn more about how to work with your emotions and reactive thought patterns using mindfulness, then please email me and let's schedule a therapy session using Skype so you can see for yourself just how effective online therapy can be for helping you overcome anxiety and depression or any other form of emotional suffering. So please email me and let's get started. I see clients throughout North America and Western Europe and the UK and as far away as Australia. All you need is an internet connection and Skype and PayPal to make secure online payments for each session. So please contact me and let's get started. Thank you.